Before we get started in the questions, maybe I'll start with you, Mike, and just talk a little bit for the group who you are, what you do, so they can get to know you a little bit.
I'm Mike Miskelin. I'm an optometrist with Valley Vision Clinic over in Neenah. I've been practicing since 2002, and so I've been working in a few different locations over the time period there. And basically just practicing general optometry. We do a lot more medical over at Neenah there than in some of the other places I've worked at, so that's very good there. Yeah, just a very busy practice. We're never for a want for things to do over there, that's for sure. And yeah, just specializing in patient care, making sure that we're doing what we need to do by them.
And one reason I reached out for Mike, he works with Dr. Thomas Rood there, and actually what was really cool is Dr. Rood actually almost self-diagnosed through eye, a way that prevented him from almost dying from a heart-related disease. So do you want to talk a minute, so that I don't know the technicalities of what it was, but it was amazing how he was able to use, you know, the eye to drive the care piece.
Yeah, in the eye, I mean, obviously you can tell a lot of what's going on systemically, and going by what his story was, and this I just got gleaned from speaking with him on it on a few occasions, is he just had a kind of little blind spot that appeared one time in his eyes, and he was, no, that doesn't happen, you just don't lose a spot of your vision. So he had one of his partner, Wes Meyer, he went and took a look inside, dilated his eyes, and yeah, he had a little plaque that had lodged itself in one of the vessels there, and he lost part of the vision there. And that basically drove him into his medical doctor, and they found out that he had a heart valve condition. And so they just monitored him on that, and I guess the story goes that he was out having Chinese food with his wife, I believe is what it was, and he started to have a reaction. He thought maybe it was just an allergy, he was just allergic to something, and so he started, getting really tightness in the chest, and then it just all hit him, and he said, we need to go to the hospital right away. And so he got into the hospital, and they're like, well, he probably had a heart attack, work you up. And he's like, no, I've got this condition here, worried about dissected aorta and all this other stuff. And they're like, no, we'll just do the workup. And he insisted. He's like, I know this is what's going on. You need to do this right away. And so one of the doctors there had kind of heard him say this, and so he begrudgingly was like, wait, fine, we'll do the workup on you here, just to kind of satisfy you. And of course, he turned white pretty much after they saw that. Okay, we need to rush you off. Put him in a helicopter down to Madison right away. And so they said
would have died.
He would have died. Yeah, there was no doubt about it. If they waited and did the heart attack workup on him there, he would have been dead before they got to Madison. They said he had hardly any time to go. His wife went with him on the helicopter, which they say they never let, unless it sounds like he's probably not going to make it.
Yeah.
So they flew him all the way down there, rushed him in. He had
but they weren't even looking at what it really was.
Yeah, he had maybe about 10 minutes. They said maybe about 10 minutes to live. And if he didn't push the issue, he would have died. And it all goes back to the blind spot in his eye. So if that never happened, he probably would have never gotten checked. He probably never would have known he had a heart valve issue. He would have had this happen still. He would have gone down to the ER. They have said, oh yeah, he probably had a heart attack, and he would have died.
And this is a partner or a co?
It was his partner, yeah.
Wow. Wow.
It's amazing, but again, just knowing self, understanding where you are, what's going on, and how can he was doing, and he's a very fit guy. He does many things to stay on top of it. But I thought, wow, that 10 minutes was. So anyway, that's a little bit of a really cool story that ended in a positive way.
Yeah.
So, Mary?
Yeah. Sure. Well, Mary Mauer, excuse me, from Holy Family Memorial, which is a health network in Manitowoc. In fact, Saturday we celebrate our 114th anniversary of existence.
Wow.
Yeah, we're faith-based, sponsored by a group of Franciscan sisters. And so we are part of a small system that the sisters run. Not a large system, but we have hospitals in Ohio, Nebraska, and Wisconsin. So over the years, well, I came to the organization over 20 years ago for 5 years. That was my plan. That's what I always tell people. But things have changed a lot, and I was provided a lot of opportunities, so I'm still there. But we went from being a hospital to a network where the bulk of our business now is clinics. Clinic and outpatient surgery and care and the like. And the hospital side is, shrinking purposefully, which I'm sure will come up today. So I have been there, as I said, a number of years, and about 5 years ago, my boss decided to kind of shuffle the cards, the CEO. So my background was largely HR kind of stuff, and philanthropy, and marketing, and support administrative services. And he said, we need to be more innovative. We need an innovative culture. We need to start going in a new direction. you will be Chief Innovation Officer. It was a little bit different than that, but it was pretty much, that's what it was, So I started myself personally learning and, just really grasping, what innovation in healthcare particularly, but in other industries too, was all about. And so that's pretty much been my charge the last 5 years or so, has been changing our culture from being conservative to innovative. And so personally and taking the organization down that path. It's been fun. It's been great.
Okay. And make sure too, Mary, it's not just the innovation itself, but the culture piece
Yes,
you bring
I
up,
will-
because
yeah.
I think that's really important.
Huge part of our
So,
game, yeah.
as we all know.
Oh yeah.
Well, I'm Elizabeth Mush. I work at Thrivent Financial for Lutherans here in Appleton. We have corporate offices here and in Minnesota and in Minneapolis, Minnesota. And my role within Thrivent is that I'm Innovation and Development Director, and I wear 2 hats. So innovation and development is one of our 3 corporate disciplines that our CEO has said are critical to our future success, one of which is continuous improvement, the other is business intelligence, and then innovation and development is the third. So I try to help people across the company apply innovation and development as a discipline and get more effective at it. That's one of the hats that I wear. The other is that I lead product development initiatives. I'm an actuary by training, and I'm working to develop for the company new financial services products. So I'm here representing the financial services industry, whereas the rest of you are in the health space. So maybe bring a different perspective, or I'm not sure how I fit in quite, but we'll just sort of chime in, certainly on the innovation and development side as we go through today.
But just from, our perspective, and why Margaret and I especially wanted you here, was the fact that, Mary, if you look in your space specifically, it comes down to creativity in those financial models to make a lot of these clinic versus hospital things working and all that. And so there could be some additional connection between you two after, because if you can't figure out the proposition in a way that financially makes sense and is not driven based on them being more proactive about managing it as patients or caregivers, what does that mean? So.
Okay. Well, and so I used to work with Elizabeth at Thrivent, actually. I was there for a number of years and worked toward the end of my time there, worked in development in terms of first developing our volunteer structure across the country, and then developing some offerings for a different market than we had traditionally served. But I left there about 5 years ago to join ThedaCare. And one of the reasons that I made that change was that at that point, ThedaCare was about 2 years into its lean journey and really trying to reinvent itself. And I thought any organization that had the courage to do that before the pressure was on, was something that was really interesting to me and that I admired. And because I was looking, I had the exposure to innovation at Thrivent, and I thought, okay, I wonder, and I also thought if any industry is ripe for innovation change, it seems like it might be healthcare. And so those were some of the reasons that I made that jump. So now I started out there in behavioral health. I work now as the vice president of spine and orthopedics for the system. So there's a traditional kind of operational leadership associated with that in terms of leading the orthopedics operations. But there's also what we would call kind of a horizontal leadership component to that, and that is if we look at how patients flow through our system. So if a patient comes in with a back or neck or orthopedic issue, and they see a therapist, they see a doctor, they have surgery, they have skilled nursing, they have therapy again. How do we smooth out that patient flow and remove those bumps as they go from one part of the organization to the other? So there's a kind of a re-engineering or innovative component.
End-to-end business process, but trying to make it smooth.
Right, and trying to get there in an organization that has been very siloed.
Right.
And do it not just turning a silo on its side, but really trying to
It really ties back to Mike's story of, starting from the eye, leading to the heart, involving the ER.
Connected.
It is all connected. The patient perspective isn't the same as how we functionally manage and optimize that system. I mean, and the same is true at Thrivent.
I mean, as a thought leader in the innovation space, I think one of the things we're missing in this healthcare space is the fact that it is so siloized. Again, if you go to an eye doctor, you see an eye doctor. You go to your cardiologist, you see your cardiologist. Something happens, they do what they know. versus looking comprehensively, not only at their experience, but also at their health history and everything else. And so I think, again, collaboration, integration, looking end to end are things that we all want to talk about. And to start that journey today, what I'd like each of you to do is think a little bit about, you viewing your industry, because you're all from different views, different experience. What's been something that has been very innovative that you'd like to talk about that really helps us better understand what you mean by innovation? Because there's a continuum from renovation to innovation. There's a lot of things being done operationally, to make sure things move faster, cheaper, better. We're trying to do more with records, all these types of things. But then what are some of the things that you would call innovation that you've seen over the last 18 months or so that are making you and your teams think differently about it? Who would like to start? Yeah, go ahead, Mary.
Well, I was going to start with what Cheryl sort of mentioned before that's taken us to a real different place, is intentional culture shaping. Healthcare by virtue is traditional healthcare, meaning we're hospital focused kind of healthcare. And 25 years ago, everything happened at the hospital. That's very much not the case. But it's very conventional, very rule-oriented, policy, procedures. I mean, I guess you don't want an ICU nurse going, well, let's see, could I be creative with this? So there's reasons for that. But as the whole model changes to population-based health and being paid for valued outcomes and, not in a hospital bed, but in a home, in a clinic, outpatient setting, we've had to start by changing just the whole mindset of people. So that's been really kind of a fun journey that we really started, I would say 5-6 years ago, to change. And we started with the leadership team, myself, and senior leaders as the first step. We needed to change the way we were behaving, operating. You mentioned the silos, all those kinds of things, kind of, having everything in little boxes to that. We're taking a patient on as an experience, and it's part of the whole network. And how do we make areas talk to each other? How do we make records talk? Although we're real advanced, most of us in that area now and everything. But that has been kind of a fun and really innovative thing to take a conservative, very approval-oriented workplace to taking risks, to being one of learning, autonomy, creative thought, going outside the box and everything. So that has been really cool. And I think the biggest thing that we've done is we've really changed from being inpatient to outpatient, sick to well. We still take care of sick people, but we changed our mission statement, which is a huge thing 5 years ago, and said our focus and our whole goal is to keep the community healthier. That's a huge mindset change and a huge culture shift change, especially to nurses who worked there for 30 years. Or, that kind of thing. So that's been hugely innovative, and we've really shifted our whole model of care from being this big of a hospital and this big of a clinic to this big of a clinic and this much of a hospital. So it's like we're reinventing, you used that word before, we're reinventing our whole organization as we go along. So it's just a huge mind shift. Just huge.
Before we switch away, Mary, the key stakeholders, especially, and not to pick on doctors, but maybe you can build off of this, but often,
Why not?
they're very set in their ways, correct, right? So how have you dealt with the administration, right? Then you have the funding sisters, and then you have the docs, and, how have you dealt with allowing people to do what they need to do, but also evolve so that they're more codependent versus I'm making this decision on my own type of thing? It's tough, right? Stakeholder management.
It's real tough. But with physicians, we started with our leaders, top leaders, general leadership team, got the employees engaged, and really started sharing success stories. And then we'd invite a doctor in, to work with us, like on a project or whatever. And we'd invite another doctor in, and that doctor tells that doctor, blah, blah, blah. And then we started setting, in terms of like just team approach that we use, getting them engaged. We kind of identified 3 top hitter doctors that had a lot of potential to help us lead the organization forward. So we've created an associate medical director kind of a role, because they've been very much champions in this whole process. One that's particularly focused on changing the culture of the physicians. So it's just full engagement. And I must say that our doctors can talk the talk like any of the employees. They know that innovation and improvement is a key strategy for us, as well as cultural change. And so, some are don't come along as quickly as others. But I must say it's been most impressive. I'll tell you, the ones that have been resisted are no longer with us.
I guess that's one way to go.
Well, either by their choice or ours. It's just not a match.
Right.
If they want a different culture, if they want kind of an old school mentality where, my pen rules, it's not going to work.
Yeah, for me, I mean, as a doctor, I mean, I look at things and I like to see what's kind of coming out, see where we're pushing things for the future, and I like to embrace new technology and go with new things. We do that all the time with the contact lens industry. I mean, they're always getting new products out there, better lenses, better things for patients. And so I always like to use the newest, latest, greatest, and there's a lot of doctors that get stuck in their ways, and they're using lenses that came out 20 years ago that, I'm not having any problems, so it's fine, keep you going on there, and that's not good for anybody. But when it comes down, if it's coming down from higher management saying, well, this is what we want to do, I kind of need to know why we're going to do that. I can't just go ahead and say, well, okay, fine. And if it's just my mentality, and a lot of people aren't like that, and I'm not resistant, but against doing anything new. But I need to be shown why this is going to be better in the long term.
Absolutely.
So,
yeah.
that's a big
So,
thing for me.
Mike, as part of that too, we talked about the need to evolve the stakeholders, but what also about the end users, right? So when you have new contact technology and all that, and you have this, again, range of patients, range of demographics, how do you go about evolving their thought process that new technology is actually the way to go?
It's always about planting seeds there. I mean, there's a lot of people have been coming to their same optometrist, or they've been hopping around because insurance says you can go here but not there.
Right.
And so they'll go where their insurance dictates. And so if somebody has been in, let's just take contact lens as an example. Say they've been in the same lens for 10 years. And it's like, well, there are newer technologies out there that we can try on you. And they might be resistant at first, but you put the seed there, and then the next time you see it, they're like, oh yeah, we talked about that last time. Let's give it a try. Other times if they're kind of, on the fence about trying something new, something better than what they're used to, I'll just give them a sample. Say, all right, let's give this a shot, see what you think. If you don't feel that that's better than what you're used to doing, then, by all means, we can continue where we're at, but, we're kind of falling behind if we're just kind of staying the course from where we're
But what
at.
I hear you say, I think is really important in this innovation space is it's not one size fits all. Not all solutions, either product or service or culture change is going to fit. You said the same thing, Mary, to everyone. So it kind of has to rebalance who it's right for and who's engaged. So what about you, Mary?
Well, it's interesting because when I first started thinking about innovation in healthcare, a lot of it comes, there's so much innovation in terms of devices and pharmaceuticals and things like that. But I actually sent Cheryl a note late in the week, and I said, okay, is it okay though if I talk about lean as being innovation? Because a lot of people, I don't think of lean as being innovative. Lean is just getting better at what you're doing. So how is that innovative? But in healthcare, that is innovative, first of all, because we've been doing things the same way for a long time. And while there's great innovation in technology and therapies, that's only driving up the cost of healthcare. That's not, there isn't anything going on that's trying to lower the cost of healthcare, with the exception of the preventative things that you mentioned before. So to me, lean is innovative because we're trying to figure out how do we remove that waste. How do we serve more patients with fewer resources, faster, better, at a higher level of quality? And so it's taking those principles and really trying to apply to the delivery of healthcare. So for me, that's been that was a mindset shift for me. I didn't realize, gosh, I never really thought of innovative. Their lean is innovation, but it is.
And within the organization, because again, this organization did start it before others, before it was needed, more or less, saying we need this capability. How has it penetrated that whole influence? I mean, is it throughout, or is it in certain areas, or what do you see the evolution needing to be?
I think it is really ingrained in the organization, and it really starts at the top of the organization. So even the first time that I met with the CEO for my Get to Know You visit, at the end of that, he said, okay, give me some feedback. What worked well? What didn't work well? What can I improve for my next conversation? And he had standard work for his one-on-one sessions. And it... it's through the whole organization. So the system leadership team and the people in the ICU that are working directly with patients and the physicians. The physicians are actively engaged. I mean, that's how you change the cultures. They're at the table for the problem solving.
And that's kind of why I asked, because I think any of these programs, if they don't become part of what you do and they're a separate standalone thing, we have this initiative lean, then it never becomes who you are, what you do, and it's not embedded in the DNA of the organization. So I think for any of this to work, it needs to become part of the day-to-day institutionalized operation. So I think that's real important. Real important.
I would agree with that, but maybe be able to share a Thrivent story because I don't think we're there yet.
Okay.
I actually saw several parallels to your story, Mary, of being in an organization with a 100-year-old history, very rules-oriented in an industry that's highly regulated, and has succeeded because we are good at risk management and careful choices and things like that. And so a culture of innovation is very different and not always just instantly accepted and embraced. And I agree that we all want to get to the point where it is embraced and embedded throughout the organization. But to make that happen, it can't always be this top-down, start with the CEO, and it's just going to happen. You know, we have a strong champion.
I think it's a champion. You know, maybe, again, who are the champions? And you guys already mentioned, and the change agents. Like, which docs, you know, did you choose to help drive it? Yeah. So I think any successful innovation needs a champion and these catalysts for change that then work to do it.
Right. So I think we have pockets of innovation, pockets of champions, parts of the company where it's very successful in really taking root. Other parts of the company, they're coming along on the journey at a different pace, at their own pace, because they're not as focused on innovation. Their job is still to protect the company and make sure that we are here for another 100 years.
Well, and I think what helped spread lean at ThedaCare was that, you know, it started out in a smaller cell, trying to solve some specific quality issues that had surfaced. And when they got done and they had, you know, had made significant improvement in a certain process and had the outcomes, they said, okay, so we now have, you know, about 124 other things on this list that we need to address.
That's all. Easy day, light day, right?
Yeah. So we need a different way to do this. And it was at that point that I think it became more deliberate about how do we spread this and how do we really empower the people who are closest to the work to do this, because it's only by having you know, you can't have 15 people or 100 people focus on this. We need all 6,000 people focused on this if we're actually going to make change happen. So I think that was a aha moment that helped move the culture.
Yeah.
And, go ahead.
Well, I was going to say, is your CEO involved though? I mean, or is he engaged? Is he a champion?
He is absolutely a champion.
Okay, cool.
And so we have very strong top-down support. Our CEO has named this as one of the 3 corporate disciplines that is necessary for our success into the future. So we have the top-down support. Right. But then from there, I think it's sort of not uniform, right? And we've carved out, again, areas where their day-to-day job is innovation. And then part of my role is to help spread that around the company. I'm just trying to point out that everybody's innovation journey as a company is different, and to think that if you have CEO or top-down support that's sufficient to spread it all the way across.
Absolutely not.
We're using a top-down and a bottom-up strategy. The bottom-up comes from those success stories. The top-down comes from his engagement, his support, his encouragement.
And let's think, as leaders yourself in your space, what are some of the characteristics of someone that you look for that can be an agent for change around innovation? You know, obviously either CEO or yourself, even Elizabeth, spreading this throughout the organization. What do you look for in others that says this person's going to help me change the world in terms of what we're trying to do here, or convince these patients that they should use the new contact lens type of thing? So what is it?
I have one. Persistence. I mean, because really persistence and that, you know, optimism, and being willing to say, okay, I saw this little much growth today, so hopefully it'll keep going. But I mean, without persistence, forget it. This can't be a flavor of the month. It will just. It won't work.
Yeah. And I think you said something else, and I just want to bring the word up, as influence too, right? Because if you're persistent, you're out there pushing it, you have an optimism that then creates some influence that you're able to do it. Because the other reality here is in all these roles, we don't have control of everyone we need to influence, right? So how do we do it? I mean, Mike, what have you seen around characteristics of these?
Well, again, we're obviously a much smaller organization than what you guys have. I mean, we got less than 20 people working at the clinic there. You got 4 doctors plus all the employees.
Right.
Everybody's pretty specialized there.
Which, by the way, that's why you're here, because you're representing a little
the smaller
microcosm
healthcare.
of it.
That's good. Yeah, and for my standpoint, for what I see every day, I mean, if as doctors we're not, excited about what we're offering, what we're doing, it's going to just trickle all the way down to everybody, and so it's just going to have a negative effect on everything. I think the employees we have in place right now are fantastic. I mean, they are very well suited for the work that we have them doing, and they're not just kind of following along, just going with the flow. They know what they have. They know how to improve upon their own techniques, and they're continually, investing in what their job is. And so I don't like just having people who are just going to be like, all right, no, it's time to work, do the work, go home.
Yeah.
You got to have some enthusiasm there for what you're doing. And again, with a smaller organization, if it's not coming from the doctors, on the way down, it's just not going to work.
Yeah, the word that came to my mind when we were talking was a fire starter. Not in a silly way, but somebody who embraces it, and someone who's happy to tell the story, share the outcomes, and can really kind of spark some fires, or the optimism, as you said, and is respected within the organization, like you said, sort of an internal thought leader. I think that's really important.
Elizabeth,
as well.
anything else you want to add?
Those are the characteristics of the individuals, but what I'd also add is something that we're looking for people who are leading projects that are going to benefit from innovation. I mean, that sounds so basic, but to find those success stories and to have a success story is the fuel for these champions and advocates to go out. And so we're trying to approach projects where we think they are developing something new, or maybe where innovation could be helpful to what they're looking at and working on. And then just by experiencing it, combined with these other characteristics that have been mentioned, as with a lot of strong leaders at Thrivent, they'll be able to carry it forward.
Very good. One thing we think about when we look at innovation, a big change it's had is not only culture but organizational changes. The need for new roles and a different structure. And in fact, it's interesting, there's a study being done, it's not complete, but it looked at like 10 years ago, organizational structures used to be in place for many years and never changed. The roles were the roles, and you find your place in the organization and you say, okay, I'm going to do this job to do that job to get this job, right? But that's not the case now. Sometimes organizations are changing multiple times within a year and adding, Mary, you already mentioned, right? Adding a role here or there to do that. So just think, over the last couple years, how based on the vision and the mission of the organization, how have things changed, or what types of new roles, chief innovation officer roles or other roles that are driving multiple things at once, like your role, Elizabeth, are evolving in order to do and make innovation happen. Do you have some examples, Elizabeth, how changes have occurred in your organization?
Yeah, I was thinking more about structure changes necessarily than role changes.
That's fine. Yeah.
Maybe just a little bit more history of Thrivent. When we started on our innovation journey, the structure that we created was to put a group of people together, like Mary and others who are leading innovation efforts, and sort of wall them off and say, within this space, go innovate.
I got out this culture and go into the basement.
Almost a skunk works team, or separate from the rest of the company, which didn't have that culture of innovation yet. They didn't have the mindset. They weren't necessarily supportive, and so to grab that group of people and say, okay, this is your job, and we're going to give you a lot of latitude within this defined space. Then on our journey, I'd say we got better at that, and the people got stronger at figuring out how you do this and where you do this, and we started spreading those people into the company. So we took people that were in that core group and started putting them into different divisions. So that's been part of our journey. Most recently, what we did, though, is we've been innovating in different parts of the company, and but still within the current operations, right? This is how we do things. This is how things get done. If you're going to do this well, then that impacts this.
Still boundaries.
Right. And so what we did was we set up a whole new division in a new company called Bright Peak, and they really were given a blank slate to redesign how they want their new company to work which is focused on young Christian families and their financial security. And they were given a blank slate to design their
Except
own
for the
systems,
target
their
and the
own-
demographic, right?
Right,
Yeah.
but weren't tied to existing operations and processes and brand standards and all the constraints that somehow are just there, but you almost don't notice them until you try to innovate.
Right.
And they're even in their own separate buildings so that they can have some of that latitude. So that was a big structure change for us
Huge.
at Thrivent, and I'd love to talk more about Bright Peak, but that's sort of how we've evolved and changed our structure and our roles.
But there's
One
two
way.
pieces of that, right? There's the ongoing innovation that's still occurring within the divisions existing in the corporation.
Absolutely.
But now this white space team that has this clean sheet of paper that says, here's your demographic. This is a new demographic for us. We're not addressing it. Come up with the products and services for that demographic. And that's kind of what we call the new emerging hybrid model, that, you know, you do see the need to have innovation, lean all the way, renovation, innovation, all those things within the existing organization. But that new white space, how do we, even your thing of, you know, from inpatient to outpatient, right? Same thing. You pushed it out to the clinics that then are a little separate, still mission wise, they're there,
Right.
but different
Right.
targets, you know, and trying to come up with a clean sheet of paper around that.
And then it's enabling them to innovate around the market, the distribution channels,
Exactly.
the product, the brand, the packaging. I mean, end to end, they can do all of that versus the innovation that I'd say is happening within the core company is maybe on a few of those elements, but not all of those elements.
So Mike, just turning to you in a much smaller organization as new needs come up and you know, you have to rearrange roles or structure to do that. How's that happen then for you to make sure that you have enough resources focused on the new technologies and new services that you're not just continuing to do what you've always done?
Well, I think it's prioritization. I mean, you gotta, you know, if it's important for you to always push it, I mean, you're gonna be kind of going on and keeping along the path there. I've not been with Valley nearly long enough to know what the long-term changes have been at the organization there. But just from what I've seen, everybody takes a more active role in everything. Is a big issue for me. For what I like to see, streamlining of care is another thing that you guys were talking about. I think it's very easy within a clinic situation. When I start working in a larger clinic, that is, in a smaller clinic situation with optometry, there's a lot of times where people come to us with certain problems, or maybe they don't even realize they have an issue until we see them, and then it's a matter of explaining it and doing the appropriate testing. And in the past, it's been a lot of just sending it out. And for us, I mean, we've got other things in place now where we can do the testing there, so we don't have to do another appointment, waste more money, you know, more healthcare dollars there. What I would love to see, I mean, we do a lot of communication amongst primary care physicians, specialists, things of that nature. At some point when, I mean, we've been on electronic health records now for a few years there, and that's great as far as communication goes amongst the doctors and the staff, and sending out reports are very good. But I'm interested to see how things can change down the road as far as tying that all into a nationwide database. I mean, they've been working on this for a while. Obviously, there's privacy concerns. There's all these other things going on, but I just think of how great it would be when I have my patients sitting there who I may be seeing for the first time, and they've got issues going on where I can just say, well, you know, where have you gone before for your these other cares? And I can just pull it up and see what's going on right away, rather than being like, all right, let's figure this out. We'll get a hold of them. You got to sign a release form. You know, get all this other stuff done, do all that. That stuff annoys me. You know, I would just like to have that information there, and I think patients in general would be appreciative of that, as long as, you know, the security of the information is there. You know, that's not going elsewhere.
Right.
So.
Now, you've all talked a little bit in your areas about evolution in culture, changes in org structure, what you're doing to institutionalize innovation. But how, and this is a tough question, so I'm not expecting all of you to answer, but how do you know what you're doing as a leader is making a difference? You know, again, most companies are struggling with metrics, right? Because it's a lot of these things, because of the cultural change, the relationship changes, the evolution with so many stakeholders, there's not just a financial number that you can put often on these things to measure. So how do you know what you're doing in the innovation space is making a difference? Any thoughts?
So I think there are two components. One is we try as we are starting to innovate around something, is to set some metrics, and not all financially. It might be in terms of access, so how long does it take for a patient to be seen, or it might be in terms of certain quality or outcome metrics.
Right.
So we try to have a balanced scorecard that looks at financial, people, patients, quality.
Right.
We look at it that way. But I think there's also, as a leader, an intuitive sense that, when you can see that people are getting on board with something, or you can see that they're starting to challenge the status quo, or when they make a statement like, wow, I never thought we would be doing this, or
Right.
wow, I never thought I'd hear that come out of my mouth. Those are the things that, as a leader, at least fuel me, in addition to the metrics that are
Exactly.
on our scorecard.
Yeah, that's good. That's very good.
Yeah,
Any
I
others
think
that
so
you?
too. Well, I was going down the same path with the same thoughts that you had, and I think of, we do, and I would believe you do this too, like blue dollar and green dollar metric kinds of things. Green dollar, what impacts the bottom line, and blue dollar, what impacts the customer's experience. And so we look at things like, for instance, we just did another employee pride survey. We do them every couple of years. And the feedback to the statements regarding innovation and improvement, that I understand why it's important. It's just such an upward positive trend. It's wonderful. That's a real statistical kind of feedback point. And customer service as well. When more people have been pleased, or more people are rating you more consistently higher, and they're like, that all those kinds of things are making a difference. And when I hear people speak to, we should do a VSA on that, a value stream analysis. Oh, I think that's a bright idea, which is sort of our package for, bright idea. I think I'm going to get it in the channel, and we should look at that. That tells you that you've made a change and that people get it. And that it's just part of their DNA, as you said before. It's really operationalized. That is like the best feeling. Like you said, intuitively, you just know, like, wow, we've gone somewhere. Would have never heard that stuff 10 years ago.
Right. And to both of you, since you've commented a little bit about, what excites you or gets you motivated, as well as what engages your employees, what is the role of storytelling? I think it's so important nowadays to tell the story, not just about the outcome and not just focus on the outcome, but the journey. And so are you using storytelling, success stories, and other things to drive the change?
We are. We're also using some storytelling to try to create the sense of urgency of why change is important, and because it helps balance the numbers. So, for instance, we could look at something like surgical site infections. We could be doing fabulous on that. We could have very, very few, a 0.000 something. But if we're not at zero, we're not there yet. And so we've got one story that we have videotaped about a patient who had a surgical site infection and how it impacted her life. And, the disaster, basically, that the disastrous consequences that this has had for her. And so that's when we always, if we ever start saying, oh, close enough, no.
We're there.
Not close enough until
Very
we're
good
at zero.
point. Very good point.
Yeah. We always say we're never there. We're never there, because there keeps changing. And
Right.
you always want there to be bigger and better, and that's the way it should be.
Right.
So there's no stop point.
And Mike, you mentioned even earlier just a little bit about you personally need to know the why, right? You need to understand. So for you, even things that are coming upon you in terms of needing change, instead of being the victim of it, you want to know why so you can.
Well, yeah. I don't like to blindly accept and say, oh, okay, well, this is being dictated, so I'm going to do it. I have to see the value of it in order for me to do, because there's obviously ideas that come down which may sound really good in the upper management section, comes down here and be like, well, that's not really going to make much difference, or taking it the wrong way, even though it looks good up here, it's not going to work down here.
Right.
And I think that's the way I will look at things, and try to perceive it as is this end value going to be a benefit for how I conduct an exam? Is it going to affect the patient in a positive way? Certainly the exam's got to be positive, but bottom line, a lot of people have insurance, don't need to worry too much about that, but with all the skyrocketing costs and everything that's going to change over here in about 4 days, it's a matter of getting it to work in that effect.
Elizabeth, for your specific situation, you have this new white space group, and lots of times they need time, right, to sort out what they're doing. So, at what point do you start the storytelling? Because there's probably a lot of interest. Okay, this group, all the boundaries have been removed. They're off here innovating, but what are they doing? So where is that time that you start to bring forward some things that are pretty disruptive, probably compared to what exists there, and start to tell the story?
I think we're already telling the story of what they're doing.
Okay.
And we're back to your question about measuring success. We're measuring success in terms of learnings.
Okay,
and so it's
good.
great to share those learnings. It's I think because they're sort of walled off, they have the permission to try things and the latitude to innovate, even if those things take longer, and have a 5-year timeline or whatever, or even longer before things are really successful in maybe financial metrics or something
But
like that.
viewing the outcome, learning as an outcome is awesome.
Absolutely.
I mean, that's really positive.
So we're not walling them off and not sharing. I'm personally actually talking to them, saying,
Right.
what are you learning already that could be applied over here, even if it's just a small nugget of, this type of messaging works and this doesn't, or this, just on a micro level. So
Right.
what are your learnings? That's already being shared, and so their successes of, when you change this, that really helps us, are already being shared. Those walls aren't
Good.
aren't up.
Excellent. So we've talked already a little bit about the role of culture, the role of the leader and change agents with the leader. Talked a little bit about the challenges around metrics and storytelling and things like that. We want to and actually we're at the end of our prepared questions and thought, but if there's one thing that you've learned as you've taken this innovation journey, what's one of the key takeaways that you would want to make sure anyone else coming behind you to fulfill your role or what you do would really listen to?
I would say just don't get stuck in the same old stuff you've been doing. I mean, I think human beings in general, creatures of habit, and so it's easy to get stuck in the same thought processes and just kind of stick to what you've been doing. No matter what industry you're with or what your profession happens to be, there's always different ideas out there. There's always different ways to do things, and just keeping an open mind to listening to what else is happening around you and trying to push that.
Great.
So I think that's a big thing. Just don't get stuck.
No, that's really good.
And the first thing that came to my mind is that it is a journey, just to underscore that it is a journey. This is not turn the switch and you change your organization, that it's baby steps. And I've sure learned that you need to put the story together, be able to tell the story and to share and celebrate each small step you take. And it's like so many things. It just starts with really small little embers,
I think Barry said look forward as long as you're making some forward
absolutely
movement.
And learn from the mistakes. We have some of our best stories have been where we've flopped on something that we thought would be terrific, but you talk about learnings, gosh, can you learn, and as long as that's part of the culture of risk is okay, and we'll have some misses, we know we will, nobody gets axed, you know what I mean, and life moves on and we learn from it and take that and move forward. That's a huge, tells people that innovation is good and safe. I mean, it's safe to be creative in that sense.
I always look at it just sort of from a pharmacological standpoint. Treatment for wet macular degeneration, it affects a lot of people.
Yeah.
And if you lose the macula, you're losing your vision pretty much right away. And for years, there was really no treatment for it. And so you have macular degeneration, we can try to, do some laser procedures and make it easier for you. So they started doing studies on a colon cancer drug, Avastin, and figuring that, this could be something that could be beneficial for macular degeneration. So they put a lot of money into, came up with a variant of the drug, ridiculously expensive, like $1,500 treatment on that. And they were doing it, they were getting some mixed results, and so then there was another ophthalmologist out there who's like, well, let's just try Avastin. It's pretty much the same thing, just a little bit different. And it's dirt cheap, it's like $50. So tried that, better results. It's actually more effective than what they were doing, and so now it's a lower cost option, better than what they were trying to do, and it is kind of on an accident, that they started using it off-label, and it wound up being fantastic.
Yeah, that's great.
Yeah.
That's a good example.
Yeah.
Elizabeth and Mary, you want to share?
Sure. Well, from there's a saying that says every system is perfectly designed to get the results it gets. And so I think it's important, while you can have people who are focusing on innovation and really trying to make change happen, you have to also be willing to look at the organization as a whole. The infrastructure, the communication patterns, the rewards, all of that stuff, and make sure that they line up with where you're going, because if they don't, then innovation won't happen, or it will be painfully slow, or you just won't move there. So I think it's being willing to realize that you have to look at both sides of that. Make sure you've got the people lined up, and make sure you've got the right infrastructure.
Yeah, that's
culture in
great.
place.
Yeah, very good.
Yeah, maybe one takeaway just from this conversation, but also that I'd share with other people trying this, is that there's so many resources out there. Look at this conversation among the four of us who are in very different, business models or business sizes or industries even. And this has been valuable and insightful. There's other organizations out there. We're part of Innovations International. There's different groups that can support you. You can network with other people. I mean, you might be on this innovation journey or be recently dubbed Chief Innovation Officer or whatever it is. And you don't have to stay within your walls, and you don't have to stay even within your own industry. Some of my biggest learnings have been when you get outside your industry, the light bulb goes on and you can bring that back.
Yeah, I was traveling back from the West Coast last night. I was sitting with the head of innovation for a luggage carrier, for luggage. And, I love the innovations because I travel so much in the luggage now, just like moving along. I barely have to touch it. It goes with me, right? And so I'm like, okay, tell me, how did you come to that? It was actually really interesting. It was off of, in hospitals, the beds that they have to move people very quickly, rapidly turn. The way those were designed is why our luggage is designed the way it is now. So that, and then airplane turbines. So between airplane turbines and the way they compete and resist and non-resist, and hospital beds and those wheels are why we have this nice luggage now. So this unrelated world thing is huge.
That's very true, because when we started on our journey, it was more we were looking at healthcare, just kind of this big. The world is this big with innovation, and ever since we really opened to open innovation and really looking at, and does that apply to us? Could we do something? What's best practice there? Why couldn't that be best practice with us?
Because if you stay right within your space, you can become very complacent because you're only looking at what is in your industry. And so, that's why I keep pushing companies to say you have to look outside your space.
We can't end this conversation, though, without talking about looking at your own customers, right? Innovation has to start. It is most successful when you look at your customers' needs.
Very good point.
And so there's even your suitcase example. The technology or the solution came from a different industry, but the real need that's being met, they understood their customer. They probably watched you walk through an airport and struggle with the bags, right. So I just can't underscore that enough. That's
market
really
and user driven.
Absolutely. Getting empathy for that consumer, even to the point of visiting them in their homes and seeing how they interact or think about your product or service. Is so just critical. Absolutely foundational.
And it's really scary, because when budgets are cut and resources are cut, the first thing to go is usually the ethnography or the research component. And then they're like, well, we know enough about, we a company of how many 100 years know enough, right? Well, I don't think that's true, because needs are evolving.
Or when projects start, there's resistance there too. People don't want to spend the time on it. And
give me the solution.
That's, I think, I'm such a firm believer that knowing your customers' needs is what's going to result in the innovation being successful in the long term.
Totally agree.
Absolutely. We do such a better job than we ever have of involving the customers. We frequently have a third of our teams be outside eyes, customers, good and bad experiences, both. You don't want a bunch of people that just think you're great. You want people who really have had some issues or whatever with the systems. And man, that's powerful stuff.
Well, it's understanding those pain points.
Absolutely.
Whether it's hauling the luggage or, the pain point of not getting the medical results in a certain period of time, or going from provider to provider, or whatever it is.
Or those family members that have no idea, what to do next or where to look or whatever.
And those customer stories are compelling.
As
you already brought up with your surgical innovation example.
Yes.
Absolutely.
Well, and now, because everybody internally is familiar with the story of Rosie, that's her name, and so, above every sink, it says "Thank Rosie" along with the instructions.
That's awesome.
So it's, there's actually you know, a
Yeah.
brand or
Reinforcement every
identification.
single time.
Yes.
Yes,
Yes.
that's really good.
That really is.
Well, I also hoped out of this forum that you would interact with each other and have another person within your network, because even though, to your point, very different views, roles, perspectives, we can always use that, you know, as when we hit a bump in the road or need some additional insight in terms of that. So